Good day, I'm Dr. Alexandra Tulea, representing TILI Research Group. I'd like to introduce the Thrombectomy in Limb Ischemia score, TILI score. With the rapid development of endovascular devices, treatment options for peripheral embolism have expanded. However, we still lack a standardized tool to objectively assess the technical success of these interventions. Current trial endpoints focus on vessel patency, complications, and clinical outcomes such as amputation or survival. While important, these measures do not fully reflect procedural efficacy. The TILI score addresses this gap. Modeled on established thrombectomy scores from cardiology and neurology, it is simple and intuitive, yet adapted to the specific challenges of limb ischemia, including multi-level occlusions, complex bifurcations, and distal peripheral embolization. The proposed TILI score uses a dual grading system, assessing both lesion recanalization from 0 to 3 and peripheral embolization from A to C. Grades 0 and 1 indicate no or only minimal perfusion. Grade 2 indicates partial reperfusion with antegrade flow after the lesion, but rest thrombi occluding maximum of 50% of the vessel, while Grade 3 indicates full flow through the entire pathway. Recanalization is evaluated in all major vessels following the primary occlusion, from the iliac arteries to the tibioperoneal trunk. Therefore, if the thrombus simply moves from the iliac bifurcation to the femoral artery, this will be reflected in the score. The second part of the score assesses embolization at the level of the crural vessels and includes 3 grades, AC, representing 1 to 3 patent crural vessels. Additional grade P denotes embolization in internal iliac or deep femoral branches. If all 3 crural vessels are occluded, or if the main stem of the deep femoral artery is occluded, this corresponds to grade 0, indicating no revascularization. This classification allows us to distinguish not just whether flow is restored, but how well it reaches the critical distal territories. So let's see how it works on this examples. This patient's presented with an initial occlusion of tibioperoneal trunk. After revascularization, there was a remaining thrombus in the trunk, and tibial anterior artery is closed so that the total score is 2B. For further information, please visit www.tiliresearch.org, where you can find detailed resources on the TILI score and ongoing work on the refinement of the TILI score for acute on chronic limb ischemia. Thank you for your attention.